In the event that you are unfamiliar with what prostate cancer is, it is the abnormal growth of all of the cells within the prostate gland. The prostate gland is considered to be a major part of the male reproductive system. The prostate cancer symptoms may or may not occur within men that are suffering from this condition. Since prostate cancer is a type of cancer that develops slowly, there are some men that have the disease that may not even realize it. Within the early stages of prostate cancer, the prostate cancer symptoms aren't evident. Relatively speaking, the screening process for prostate cancer is simple to perform, with a PSA test and a prostate examination annually. The majority of patients that have prostate cancer are going to be identified and with a high chance of finding a cure relatively. Overall, screening for all of these diseases is just a fact of modern-day medicine. In relationship to prostate cancer, this issue is rather complex, because the overall benefit to all of the patients is very far from being completely clear. A screening is performed before you ever have any of the symptoms of cancer, just to test to see if the cancer is present. When a screening test is performed, it can normally find cancer in its early stages. All of the prostate cancer symptoms are the essential key to determining whether or not an individual is at risk for developing prostate cancer. With all of the early self-diagnosis, one will be able to create a detour completely away from prostate cancer's deadly root. Prostate cancer symptoms within their early stages can reflect characteristics such as urinary incontinence and difficulties. Often, there are men that experience frequent urination, even though the amount of urine that is passed is quite small. Often, the urinary incontinence follows menopause or childbirth. Prostatic or urine fluid cytology could reveal some cells that look rather unusual. You should also take into consideration that all of the experts report that the PSA tests aren't reliable, that they are searching for all of the better ways that they can diagnose prostate cancer. Prostatic or urine fluid cytology could reveal some rather unusual cells. One of the other tests that are normally performed when all of the prostate cancer symptoms are present is the DRE or digital rectal exam, which is performed by the oncologist, proctologist, and doctor. All of the blood within the urine is normally a symptom of something other than the prostate cancer. However, within individuals that do have the prostate cancer, a presence of blood within the urine could be an indicator that the condition has advanced, or either it has spread from the prostate and on into the urethra or bladder. Normally, the blood tests will confirm this diagnosis.